Hi, Nurse Savage here. We are going to do the screen share here and we'll get started. As I said, this is Victoria Savage, Nurse Savage on your side, and I'll take my specs off now. We are back with Freeing the Sandwich Generation, and like I said last time, today we're going to talk about declining balance. And I want to remind you that those of you who watch all the way to the end of this series of webinars, I have some free gifts because I really want you to get all this valuable, potentially life-changing information. So, declining balance. Well, most people figure that balance is going to decline as part of the normal aging process. And while this is partly true, it is absolutely something that can be worked on and improved at every age. Trust me, unless you have a inner ear issue or a neurologic problem, you can improve your balance. Maybe not to this point, but actively working on it is a huge way. And it can be as simple as just standing on one foot, counting, and then standing on another foot and counting until you have to put that foot down. And you'll find in just that one session, your balance will improve. Now, I recommend standing like at a bar with a chair behind you while you're practicing this or while you're having your aging loved one practice. But doing that 3 or 4 times a week for just 3 or 4 minutes will improve their balance. I don't recommend trying to improve your balance by rollerblading, but you want to address the most common factors causing their decline in balance and introduce a few ways for them to actively work on improving balance. And there's a few things you can do. And consider assistive devices, certainly, until their balance is better, like a cane or a walker. So what are some of the reasons that people's balance decline? Well, muscle mass loss, and that is a normal part of aging, but again, it's something that we can work against. Disuse syndrome, which creates faster muscle mass loss, and medication side effects. Some of the very medications people on are actually causing muscle mass to decrease by their very side effect. So let's introduce muscle mass loss. I want to look at their protein intake, and the reason I say that is our body needs protein just to do its daily functions. And so if your loved one is not taking in the minimum amount of protein they need, which a good rule of thumb is at the very least 50 grams a day, your body will start using its own muscle mass as the protein stores it needs, which means it will attack your core and your thigh muscles because those are the largest muscle groups, and those are incidentally key muscle groups to helping maintain balance. So you want to work on core strengthening, and you want to strengthen the thighs, and so introduce some weight-bearing exercises. So let's talk about the protein intake. Why do people stop taking in enough protein? Well, sometimes it's a chewing issue. Sometimes it's just they can't digest meat as well. They don't feel like cooking it, so they just don't. They pick on easier foods. So you need to look at some options to circumvent those roadblocks. Eggs are a nice soft protein. They're 7 to 8 grams of protein per egg. Cottage cheese is a wonderful way to get protein in. A half a cup is 15 grams. And peanut butter, a tablespoon is 7 grams of protein. So those are all soft forms, and there's certainly a lot more. If their appetite is really diminished, really small, you might consider those protein-enhanced drinks to get them enough for the day. And then you want to start working on building up their muscle mass again or maintaining it. Core strengthening is one. They don't have to get down on the floor to do sit-ups to do that. This is a great way to strengthen the side muscles. When these ladies come back up to a seated position, straight position, they will have worked their side core muscles. If they go forward and suck their tummy muscles in as they come up, they will work their core muscles. If they don't suck their tummy muscles in, their back will be getting worked out, which can be an okay thing, but you definitely want to use those core muscles. Then if they, say, added a couple of soup cans to when they bent forward and came back up, they would be adding weight to that core muscle strengthening. Weight-bearing exercises, walking on uneven surfaces is another great way to improve their balance. But again, you want to do it safely. And walking in and of itself is a good way to help maintain balance, but you probably will need to do a little bit more deliberate practice, like I talked about, standing against, particularly if they've lost their balance quite a bit. Another thing is if you notice that they are weakening a bit, their balance is suffering, get them into their physician, have him write a prescription for physical therapy. Medicare will pay for it with a doctor's prescription as long as they are showing improvement. So if they continually improve, they can do their physical therapy for quite some time. The minute they plateau, therapy has to step out, Medicare will no longer pay. Then you can get them into something like the Y, or senior centers have some exercise programs. Tai Chi is a wonderful balance exercise. Frequent fallers over 80 who started practicing Tai Chi just 1 hour a week for 12 weeks showed a 40% decrease in the falls. And these were people that were 80 years old. So it is never too late to improve your balance. Disuse syndrome. Well, several reasons why we stop using our muscles. Pain, our expectations, and excess weight. Expectations is huge. A gal in the 70s, a psychologist, did a study on men, and she took 20 men, all who required some kind of help with an activity of daily living, meaning they needed help with dressing, walking, transferring out of a chair, toileting, or eating. And she took a camp and she retrofitted it to look like the 1950s when these men were in their working prime. And everything in there, the furniture, the music, the literature, everything looked like the 50s. And so then she took half of the men, 10 of them, and she told them to behave like they did when they were working men in the 50s. And the other half she had just go hang out for the week. Well, after 7 days, she took before and after pictures, and she had people who had not seen these gentlemen before look at both pictures. And they judged the men that went in and just hung out for the week as appearing 10 years younger than their before pictures. The men who actually behaved like they did in the 50s appeared 20 years younger than their before pictures. But the really amazing thing was that none of them needed help with an activity of daily living. And it wasn't because they wanted to have help with toileting or dressing or walking. It's what they expected was going to happen as they age. So our expectation and our beliefs about aging is huge. So produce opportunities for them to get out, get engaged, and stay engaged in life. Some volunteerism is huge because it gives them a sense of purpose and a sense of value. And look for examples of people in their age group continuing to do things in life, not just giving up. So pain is probably the single biggest reason people stop doing physical activity, and it's a valid one. Movement actually helps decrease pain. So if you can convince them to get up and start moving, generally they feel a little bit better. Use physician-recommended pain relievers. And you really want to talk to their doctor about this because let's say they're on a blood thinner. You don't want them to be taking ibuprofen because that further thins their blood. By the way, omega-3 products, which are really great for their brain, also cause blood thinning. So you want to let the doctor know what they're taking, and hopefully he can give you some advisement on how to continue to use like that omega-3 product. And massage and moist heat therapy on those joints is a good way to help them feel less pain while they're getting ready to go do these activities. Topical pain relievers, like some of the essential oils out there, are very effective in relieving joint pain, or at least making it less impactful on them. And then, of course, excess weight. You want to look at their eating patterns. Look in their cupboards. If they're telling you, I don't eat all that much junk, we'll find out what they're really eating. And then determine their commitment. If they're not at all concerned and committed about this, then honestly, you're fighting an uphill battle. But if they want to be active and do stuff again, then they're gonna be involved in the process. And look at different exercise options to reduce their weight. Eating patterns. Sometimes it's easier to get buy-in if you don't tell them all the things they can't have, but you add in things to their diet, like fruits and vegetables. Increase the amount of that, and limit for them the sugary and high-fat foods. Don't take them away completely. That's not how they prefer to eat, and that's not how they're going to live. But if you can increase the good foods, then their appetite will hopefully dictate fewer of the high-fat and sugary foods. I know that if you tell me I can't have something to eat, that's exactly what I want to eat. So recap today, you want to look at their protein intake. You want to get some balance exercises instituted for them, and you want to look at some of the reasons they are not wanting to get up and move around and help those reasons get some address, and then hopefully they'll start moving again. This is Victoria Savage, Nurse Savage on your side. If you have some questions for me, please visit me on Facebook at Ask Nurse Savage. You can post a question right there in the comments section, or you can private message me on that page, and I might just have an answer that'll help. This is Victoria Savage, Nurse Savage on your side. Next time when we meet, in a couple of days, we'll be talking about how to maintain mental sharpness. Again, this is Victoria Savage, Nurse Savage on your side.